This morning, Monday, June 8th, the State Department of Health reported that the number of COVID-19 cases in Miami-Dade County nears 20,000, and 767 people in our county have succumbed to the virus. Plenty is going on right now. Protests, continued opening up of commerce and recreation. So first, let's take a look at the data. The county daily number of cases, while lower than it was at its peak, has seen a noticeable uptick as we have loosened our economy. But the percentage of positive tests is still relatively low, even if it does fluctuate. Also, the county hospital admissions have been relatively low, which is a good sign since it appears that there are more people checking out of hospitals than checking in. So we will continue to cautiously and in phases reopen. Now, we are only able to reach this point of reopening because of you and your efforts to limit the spread of the virus. I can't stress that enough. One of our medical consultants, Dr. Morris, who directs the Emerging Pathogens Institute at the University of Florida, makes some very good observations about how we got here and the need to be cautious.
Per my earlier comments, the initial COVID restrictions were actually very effective from a public health standpoint. We were able to slow what was a rapidly increasing number of cases and bend the curve to where we saw a very real decrease in case numbers. Now, what's interesting is that we can actually see how much people are moving around using cell phone mobility data. And actually, with some studies that have been done, in part by folks here at the University of Florida, it's been possible to show that the level of mobility in Florida dropped to less than 50% of what it had been before the restrictions were put in place. So people listened, they did what was asked of them. We saw a dramatic decrease in mobility and a dramatic decrease in case numbers. It worked. And again, we can document that people really did stay home. However, what we've seen since then has been a slow rise in mobility, particularly as the state has opened up, combined with a slow upward trend in new case numbers in Florida as well as in Miami-Dade. So again, this is not totally unexpected. People are moving around more. We're starting to see more disease transmission. Again, it's been great to see the increased economic activity, but I will have to say that the accompanying gradual increase in case numbers is of concern. This is still very much a disease that can kill, particularly in older populations with chronic underlying diseases, such as, for example, diabetes and other chronic diseases that one sees within our population. And the virus is still very definitely present in our community. So what we need to do is make certain that as things open up, we don't create a setting in which we start to see, again, rapid increases in case numbers. We slowed things down. We need to make sure that we keep it slow.
So it would be wrong to believe we don't need to socially distance ourselves, or we don't need to wear masks we're asked to, or we shouldn't wash our hands regularly. These are all important to keep doing. Regarding opening up, we are entering the next phase of actions. Today, the county is opening lots of elements, mostly related to recreation. Gyms are opened, as are dog and skate parks. Doubles tennis is back, full court basketball is not. Playgrounds and exercise equipment, though, remain closed. Now, our city commission previously approved beach openings, and it will appear that Mayor Jimenez is opening them on Wednesday, June 10th. The county's 9 p.m. curfew is no longer in effect, but our city's municipal midnight curfew is. I appreciate there may seem to be a randomness about some of these decisions, and I cannot explain all of them. The bottom line is, whatever we are doing, we need to practice physical distancing. Now, we have already opened up a virtual camp for our kids, and our city intends to open up its actual summer camp program on Monday, June 15th, with a very limited number of slots that will be awarded via a computer-based lottery. Here is the contact information for our parks team if you'd like more information. Now, you should talk to your pediatrician about whether summer camps work for your family. Dr. Judy Schechter, a Miami Beach resident who is also the chair of pediatrics at University of Miami and served on the county's camp opening task force, gave some very thoughtful advice on this very question.
Hi, I'm Dr. Judy Schechter. I'm a pediatrician and a parent. Like you, I've spent a lot of time learning everything I can about the coronavirus pandemic, and I continue to try to make the best decisions I can, even though we don't have all the information we need. Sometimes it seems like we've been living with the effects of this virus for nearly forever, but in truth, we've been learning about it for less than 6 months. So deciding what's best or safest for our families is still not straightforward. This week, Miami-Dade County opened up summer camps. Some of them will start or remain virtual, others are in person, with children and staff gathered together for sports, arts, and learning. Whether you send your children to camp or keep them home this summer is your decision, one that balances a number of important factors. Summer camp has a lot of benefits. Camp is an opportunity for fitness, for learning through play, to make friends, to meet adult role models, and acquire new skills or reinforce what was learned during the school year. For some families, parents returning to work know that they need camp to assure a place where their children will be looked after and even nurtured. Given such benefits, many families will choose to send children to camp this summer. And when they do, they should expect the children and staff wear masks, wash their hands frequently, keep a distance from one another whenever possible, and stay home if feeling any symptoms of illness. These measures will not eliminate, but can reduce the risk of getting sick or passing the virus to others. Other families will decide to keep children home this summer. They may choose to do so because the chance that their child or another family member catches the virus is too high a risk to take. Persons at risk due to advanced age or certain health conditions should be very careful to protect themselves from unnecessary contact with others. Even people who might not show or feel symptoms can carry and spread coronavirus. Healthy children, who fortunately are generally not severely affected by coronavirus, may still become infected and pass the virus to others. So when assessing options for the summer, parents should consider who else lives or visits at home. If members of the family or household are at high risk because of age, diabetes, heart disease, hypertension, immunodeficiencies, and other conditions, some parents will seek to reduce the risk of contagion by keeping their children home. These are not easy decisions. They require a balancing of benefits against risks and consideration of all of those people around us. Different families will come to different conclusions. For sure, this will be a different sort of summer. Hopefully, it will be one in which we all learn, grow, and gain special memories as we socially connect despite the needed physical distance. I'm wishing you and your family a healthy and happy summer.
Finally, I'd like to speak to the protests spurred by the killing of George Floyd. There is no question that this tragedy has caused the nation to take a long and needed look at policing and broader issues of race. And no one should think that they are exempt from this kind of self-reflection that is so long overdue. You should know that our police department has made significant efforts to lead when it comes to use of force in policing. We were the first city in Miami-Dade to deploy body cams across the department. We do not use chokeholds, and we teach de-escalation in response to resistance, and we train our officers on implied bias. Our police have a duty to intervene and report instances of wrongdoing by other officers, and we use outside agencies to investigate all police discharges of weapons and in-custody deaths. But the hallmark of a great department must be its willingness to truly examine itself, as that is the only way to improve. We can and must do better. As I have said many times and believe to my core, we are not the city that simply checks all the right boxes. We are the city that creates the boxes for other places to check. It is with this goal in mind that our commission has asked our police chief to begin that process of self-examination and report back to our commission. Chief Clements has embraced this mission, and I have great confidence that he is up to the task. These are interesting times, and there is stress. It is times like these when our mettle as a community is tested. It's almost too easy to disagree with one another about policing, race issues, and even the wearing of masks. But we are the same people, and this is the same community as we were a few months ago, even if we are being tested. We know how to disagree agreeably and how to demonstrate mutual respect, even in times of distress and conflict. That is who we are and who we should always aspire to be. So as always, thanks for your patience and calm. Stay healthy and mostly at home.